6:40 in the evening, and you are drying your hands at the kitchen sink when you notice it. The tips of your fingers look wrong. Rounder than they used to be. The nails curving down over the ends like the back of a spoon turned upside down. You tell yourself it's just age. It is not just age. Hold your hand up to the light for a second. There's a word for this: clubbing. And it shows up in a heart condition that affects more than 6 million American adults. What you may be looking at right now on your own two hands is one of the oldest warning signs in all of clinical medicine. And it has almost nothing to do with your nails, and almost everything to do with your heart and your lungs. I want you to hold your hand up to the light for a moment. Look at the angle where the nail meets the skin. In a healthy finger, there is a small window there, a little diamond of light. In a healthy finger, the nail leaves the skin at an angle of about 160 degrees, a gentle slope. And that slope is what creates the window. When that window closes, when that angle flattens past 180 degrees, roughly in most people, when the base of the nail rises up and the fingertip swells into a bulb, doctors have a name for it going back more than 2,000 years. Hippocrates himself described it around 400 years before Christ in patients whose chests were filling with infection, which is why to this day some physicians still call these Hippocratic fingers. It is quite possibly the oldest physical sign in the entire written record of medicine. Older than the stethoscope by more than 2,000 years. Older than the thermometer. Older than blood pressure itself. And after the age of 65, when the heart and the lungs are already working harder than they once did, that closing window can be the body telling you that oxygen is not reaching your tissues the way it should. Most people never notice it. The ones who do usually assume it's arthritis, or thinning, or nothing at all. Here is exactly what I am going to walk you through in the next 20 minutes. First, the one simple test you can do at your kitchen table using only your two thumbs and 30 seconds that tells you whether the warning sign is present on your hands tonight. Second, the exact difference between a nail that is aging normally and a nail that is signaling something underneath, so you stop guessing. Third, what is actually happening in the smallest blood vessels of your fingertips when this change appears, explained in plain language you can repeat to your own doctor. Fourth, the bluish color change that can appear alongside it, and why the combination of the two matters far more than either one alone. And fifth, the single most common mistake people make when they finally do notice. The mistake that turns a recoverable warning into a missed one, and it's the one your own kitchen light has been hiding from you. Let me tell you who I am, so you know why I am the one saying this. I spend my days working through the medical research on how the body signals disease before the disease announces itself, translating what appears in the clinical journals into language that a capable adult can actually use. I am not your physician, and nothing here replaces the person who knows your chart. But the pattern I'm about to describe is one of the most reliable physical signs in the entire medical literature, and it is one that seniors, and the people caring for them, miss over and over again. Let me tell you about a man I'll call Raymond. Raymond is 71. He worked 40 years as a machinist in a shop outside Cleveland, retired at 66, and spent his mornings the same way for years. Coffee at the kitchen table, the newspaper folded to the crossword. Raymond was, by his own description, fine. A little short of breath climbing the stairs, but everyone his age was. A little tired by mid-afternoon, but that was retirement. His blood pressure was managed. His doctor was satisfied. Raymond assumed he had years of the same quiet mornings ahead of him. What Raymond noticed first was that his wedding ring had gotten tight. He'd worn it since 1974, and suddenly it was pinching. He figured he'd put on a few pounds. Then his daughter, home for a weekend, was holding his hand across that same kitchen table, and she stopped. She turned his fingers over. The tips, she said, looked swollen. The nails looked different, rounded, shiny, curving down at the ends. And there was one more thing she noticed that Raymond had felt for weeks without registering it. When she pressed on the base of one of his nails, it felt slightly spongy, as if the nail were floating on something soft underneath, the way a small boat rocks on water. Doctors call that fluctuance of the nail bed, and it is often the earliest physical change of all. Present, before the shape of the fingertip has visibly changed. Raymond looked at his own hands as if for the first time in years and realized she was right. He could not remember when they had changed. That was the frightening part. The change had happened so slowly that he had watched it every single day and seen nothing. And there is a reason for that. Clubbing develops over weeks to months, sometimes longer, and a fingernail only grows about 3 millimeters a month. A change spread across 180 days, viewed daily, is invisible. Your brain updates its picture of your own hands every morning, so there is never a before and after to compare. His daughter, who saw those hands twice a year, had a before. Raymond did not. Raymond did what most people do. He decided it was arthritis. He bought a jar of cream. For 3 months, he rubbed cream into fingertips that were quietly telling him his heart was not moving enough oxygen-rich blood through his body. It was only when the shortness of breath got bad enough that he could not finish mowing his own lawn that he went in. The nails, it turned out, had been the earliest sign, months ahead of everything else, and he had covered them in cream. I am telling you Raymond's story not because Raymond is unusual, but because Raymond is completely typical. The slow change you cannot date, the reach for the ordinary explanation, the months lost to a cream. Raymond is what this looks like on a real hand in a real kitchen, and the single decision he made, deciding it was nothing, is the decision waiting for a great many people watching me right now. So let me explain what is actually happening, because once you understand the mechanism, you will never look at a fingertip the same way again. The medical name for this rounding and swelling of the fingertips is clubbing. It has been recognized since the time of the ancient Greek physicians, who described it in patients with diseased lungs. For most of history, no one knew why it happened, and centuries of proposed theories went nowhere. We understand it much better now, and the modern explanation is one of the most elegant pieces of detective work in clinical medicine. Here is the plain English version. Deep in the tip of every finger runs a bed of the tiniest blood vessels in your body, capillaries so narrow that red blood cells have to pass through them in single file. Now, in your bone marrow, there are giant cells called megakaryocytes, and their entire job is to break apart into platelets, the small cell fragments in your blood that handle clotting. Here's the part almost nobody knows. In a healthy body, many of those large fragments and immature clumps pass through the lungs first, and the fine mesh of the lung's own capillaries acts like a sieve, breaking them down into properly sized platelets before they ever reach your fingers. Your lungs are not just an oxygen exchanger. They are a filter. But when there is a problem that lets blood partly bypass the normal path through the lungs, what doctors call a right-to-left shunt, or when the lungs and heart are diseased and not doing their job the way they should, those oversized fragments and clumps slip past the filter, travel down the arteries of the arm, and arrive at the narrowest point in the entire journey, the capillaries of the fingertip, where they lodge like logs, jamming in a narrowing river. And when they lodge there, they do not just sit. Platelets are little packets of chemical signals, and when they wedge into those tiny vessels, they release growth factors. Most importantly, two called platelet-derived growth factor and vascular endothelial growth factor. Those are chemical messengers whose literal job is to tell local tissue to build. Build more blood vessels. Build more connective tissue. Recruit more cells. Over months, that construction project is what rounds out the fingertip, thickens the soft tissue under the nail, and lifts the base of the nail so it floats and curves. This idea was first put forward in a landmark paper by Dickinson and Martin in The Lancet in 1987, and it has held up remarkably well. An analysis in the European Journal of Clinical Investigation in 1993 described the same impaction of those platelet-derived fragments in the nail bed capillaries, and pointed out that when blood is allowed to bypass the lungs, the mechanism runs unchecked because the filter has been taken out of the circuit. And a review published in the British Journal of Hospital Medicine in 2016 identified exactly this: growth factors released by those platelet clumps, as the most likely explanation for why the fingertips club. There is even genetic evidence pointing the same direction. Researchers studying rare families in which clubbing runs as an inherited trait found mutations in a gene called HPGD, whose normal job is to break down an inflammatory signaling molecule called prostaglandin E2. When that molecule builds up, fingertips club. Even in people with perfectly healthy hearts and lungs. In other words, three completely independent lines of evidence, the shunt physiology, the platelet biology, and the genetics all converge on the same story. The fingertip clubs because growth signals are arriving that should have been cleared, and something upstream, usually in the chest, is why they are arriving. Now, why does the heart come into this? Because the whole point of your heart and lungs working together is to load your blood with oxygen and push it out to every tissue, right down to the last capillary in your smallest finger. Your heart moves roughly 5 liters of blood every minute at rest, and every drop of it is supposed to pass through the lungs, pick up oxygen, and get delivered. When the heart weakens, when it can no longer pump enough oxygen-rich blood to keep up with the body's demand, the tissues furthest from the pump feel it first. And nothing in your body is further from the pump, in circulatory terms, than the tips of your fingers and toes. The National Library of Medicine, through its Medline Plus service, describes heart failure exactly this way, as the heart being unable to pump enough oxygen-rich blood to meet the body's needs, so that organs and tissues do not get the blood flow they require. And this is not a rare condition. Heart failure affects more than 6 million adults in the United States alone, and the risk climbs steeply after 65, which is exactly the audience I'm speaking to right now. The National Heart, Lung, and Blood Institute, part of the National Institutes of Health, describes the same underlying failure of the heart to keep up. And coronary artery disease, where plaque narrows the vessels feeding the heart muscle itself, is described by Medline Plus as reducing the blood and oxygen delivered to the heart, which is often the road that leads to that weakening in the first place. It is the most common form of heart disease and the leading cause of death for both men and women in this country. Think about the sequence for a moment, because it matters. Plaque narrows the arteries feeding the heart. The heart muscle, starved of some of its own supply, gradually weakens. The weakened heart moves less oxygen-rich blood. The tissues at the far end of the line, the fingertips, register the shortfall first. And in certain heart conditions, particularly ones involving abnormal connections that let blood skip the lungs, the platelet filter fails at the same time. The fingertip sits at the intersection of both problems, which is precisely why it has been medicine's early warning light for 24 centuries. The papers in the dermatology literature go further and say something you need to hear plainly. A paper in Dermatologic Clinics noted decades ago that clubbing, and its cousin the spoon-shaped nail, can be outward manifestations of internal disease, and that when a doctor sees them, the correct response is to go looking for the underlying cause. This is why, to this day, medical students are taught to examine the hands first, before the chest, before the heart sounds, before anything. The hands are the body's public bulletin board. In other words, the nail is not the disease. The nail is the messenger. Raymond's fingertips were doing their job perfectly. It was Raymond who covered the message in cream. Let me anchor this back to that man at the kitchen table. When Raymond's daughter turned his hand over, what she was seeing was months of those tiny vessels quietly rebuilding themselves because the oxygen was not arriving and the growth signals were. His weakening heart, his tightening ring, because the same fluid retention that comes with a struggling heart swells the fingers too. His swollen fingertips. All the same story, told in 3 different places on his body, and the fingertips told it first. Now, Raymond is one hand. Let me show you 3 more, because this does not look the same on everyone. Consider a woman I'll call Eleanor, 78, in a retirement community in Sarasota. Eleanor never had chest pain, never had the classic warning everyone waits for. And here is something worth knowing, because it applies directly to Eleanor. Women and older adults are far more likely to have heart trouble without the crushing chest pain the movies have taught everyone to expect. Their warnings are quieter: fatigue, breathlessness, and signs like the ones on Eleanor's hands. What she had was fingertips that had rounded so gradually that she genuinely believed they had always looked that way. Her tell was different. Eleanor bruised the beds of her nails carrying grocery bags, and when her physician's assistant finally examined her hands, it was not the shape she flagged first. It was the color. When Eleanor pressed on her nail beds, the pink was slow to return. In a healthy hand, you press the nail until it blanches white, release, and the pink floods back in under 2 seconds. Clinicians call it capillary refill, and it is one of the fastest bedside checks of circulation there is. Eleanor's took closer to 4 seconds, and there was a faint, dusky tint at the very tips. Eleanor is the case that teaches you the shape and the color travel together, and that a person can have this sign for years and never once suspect it, because there was no dramatic day it appeared. Now consider a man I'll call Frank, 66, a lifelong non-smoker in Denver who prided himself on it. Frank assumed clubbing was a smoker's problem, something that happened to other people. It is a reasonable assumption, because clubbing genuinely is associated with lung disease, and lung disease is associated with smoking, so the mind draws a straight line. But the line is wrong. Frank's fingertips clubbed anyway, because the mechanism does not care whether you ever touched a cigarette. It responds to what the heart and lungs are doing with oxygen and with those platelet fragments, not to your history. Clubbing appears in heart conditions, in lung conditions that have nothing to do with tobacco, even in some diseases of the liver and the gut, because anything that disrupts the filtering and the oxygen delivery can trip the same wire. Frank is the case that breaks the assumption. If you are sitting there thinking this cannot be you because you never smoked, Frank is the reason to look at your hands regardless. A clean lifestyle is a wonderful thing, and it is not an exemption from looking. And consider a woman I'll call Doris, 83, who lived alone and had the sharpest eyes for everyone's health but her own. Doris caught the change in her sister's hands across a Thanksgiving table and said something. Her sister got checked. Her sister's early heart trouble was found while there was still room to manage it, while it was still a matter of medication adjustments and monitoring, rather than a hospital admission. Doris never noticed her own hands until her niece noticed them for her the following spring. And that is not a coincidence or a personal failing. It is the same blind spot that caught Raymond. You cannot see a 6-month change in a thing you look at every day. The people who see your hands occasionally have the comparison you lack. Doris is the case that tells you this sign is often caught by the people who love us before we catch it ourselves, which is exactly why I want you to look at the hands of the people you care about, not only your own. 4 hands, 4 stories, 1 message. Now let me give you exactly what to do about it, in order, starting tonight. First, do the window test. Hold your 2 index fingers up and press the backs of the last section, the nail sections, together, nail to nail, fingertip to fingertip. In a normal, healthy hand, a small diamond-shaped gap of light appears between the bases of the 2 nails. Doctors call this little window the Shamroth sign, and the story behind the name is worth 30 seconds of your time. Leo Shamroth was a celebrated South African cardiologist, one of the great authorities on the electrical rhythms of the heart. In the early 1970s, Shamroth himself fell seriously ill, 3 separate times, with an infection of his own heart valves. And being the kind of physician he was, he watched his own fingertips club during the illness and unclub as he recovered. And he noticed that the diamond window between his nails vanished and returned along with the disease. He published the observation in 1976, and the world's simplest heart and lung screening test has carried his name ever since. Notice what his own case proved, by the way. Clubbing can reverse when the underlying cause is treated. This is not a one-way door. A case report in the journal Skin Appendage Disorders in 2019 documented the same thing in the modern era, the sign appearing in a patient with disease in the chest and then reversing after the underlying tumor was removed. The fingertip rebuilds itself in both directions. Catch the cause, and the messenger can stand down. So do this test tonight under a good light on both hands and check more than 1 pair of fingers, because clubbing usually affects all of them. If the diamond window is clearly there, that is reassuring. If it is closed, you note it and you move to step 2. This costs you 30 seconds and nothing else. Second, learn the difference between normal nail aging and a warning sign so you stop guessing. Nails genuinely do change with age. They can grow more slowly, up to half as fast as they did in your 30s. They can thicken, develop ridges that run lengthwise from the cuticle to the tip, and lose some shine. A review in Skin Appendage Disorders in 2024 laid out how the accumulated exposures of a lifetime, sunlight, pollution, diet, all leave their mark on aging nails. That kind of change is gradual. It affects the surface and the color, and it is generally harmless. Here is a simple way to hold the distinction in your head. Aging changes the surface of the nail. Disease of the kind we are discussing changes the shape of the finger. Lengthwise ridges, some brittleness, a duller finish. That is the surface. That is time. And it is fine. What you are watching for is different. You are watching for a change in the architecture of the fingertip itself. The rounding, the bulbing, the base of the nail lifting and turning spongy so the whole nail curves down over the end like the back of a spoon. There is even a quick check for this beyond the window test. Look at your finger from the side, in profile. In a healthy finger, the fingertip is never deeper, top to bottom, at the nail bed than it is at the last knuckle. In a clubbed finger, it is. If the end of your finger has become the thickest part of your finger, that is architecture, not age. Ridges and dullness are aging. A change in the architecture of the fingertip is the sign that sends you to a doctor. Third, look for the color that travels with the shape. Alongside the rounding, watch for a bluish or dusky tint in the nail beds or the fingertips, and watch for how quickly the color returns when you press the nail and let go. That capillary refill I described in Eleanor's case. Pink back in under 2 seconds is normal. Medline Plus from the National Library of Medicine explains that a bluish discoloration of the skin, called cyanosis, is a sign that the blood is not carrying or delivering enough oxygen. The physics of it is simple and worth knowing. Blood that is loaded with oxygen is bright red. Blood that has given up its oxygen is darker, bluer. When enough of the blood in the small vessels near the skin is running low on oxygen, the skin over it takes on that dusky, bluish cast, and the nail beds, where the skin is thinnest and the vessels closest to the surface, show it first. That is why nurses and paramedics look at nail beds before almost anything else. One practical note for this audience. In people with darker skin, the blue tint can be harder to see in the fingertips, so check the nail beds, the lips, and the gums, where it shows more reliably. And one caution in the other direction. Cold hands alone can look bluish because chilled vessels clamp down, so warm your hands first, then look. When you see the bluish tint and the changed shape together, on a person over 65, that combination is far more meaningful than either sign alone, because the shape tells you the process has been running for months, and the color tells you it is running right now. It is the combination that Eleanor's examiner flagged. Note the color, note the shape, and bring both to your appointment. Fourth, take the finding to your doctor in the right words. Do not walk in and say your nails look old. Say plainly that you have noticed a change in the shape of your fingertips, that the Shamroth window has closed, and that you want your heart and lungs evaluated. Words route you through a medical system. Old nails is a cosmetic complaint, and cosmetic complaints get cosmetic answers. Clubbing is a clinical sign, and it triggers a specific, well-worn checklist in a physician's mind. Listen to the chest. Check the oxygen level with a pulse oximeter on that very fingertip. Consider a chest image. Consider a look at the heart. The dermatology literature is explicit that clubbing warrants a search for a primary cause. When you name the sign correctly, you point your physician straight at the question that matters, instead of leaving them to chase a cosmetic complaint. One more practical tip that costs you nothing. Take a photograph of your hands tonight, with today's date, whether or not anything looks wrong. 6 months from now, you or your doctor will have the one thing Raymond never had, a before. This is how you make sure the messenger gets read. Fifth, and this is the one that undoes people, do not reach for the cream. Do not decide it is arthritis or a vitamin you're missing, or simple age, and treat the fingertip while leaving the cause untouched. That is precisely what Raymond did for 3 lost months. And notice why the cream is so seductive. It gives you something to do. It converts a frightening unknown into a manageable routine, a little ritual of control every morning. And the ritual quietly substitutes for the appointment. Arthritis, for the record, attacks joints. It makes knuckles stiff, painful, and knobby. It does not make the soft tip of the finger balloon or the nail float on a spongy bed. Those are different findings from different processes. And 5 seconds of pressing on the nail base tells them apart. A change in the shape of the fingertip is not a skin problem to be moisturized away. It is a signal from inside, and the only correct response is to have the inside checked. The single most common mistake, the one your own kitchen light has been hiding by making the slow change look like nothing, is treating the messenger and ignoring the message. Now here is one more thing, a step above the rest, and almost no one thinks to do it. Do not only check your own hands, check the hands of the people you cannot examine from the inside. your spouse across the breakfast table, your aging parent whose hands you hold, your sibling at the holiday. Because this sign has a rare and valuable quality, it is visible from the outside to anyone without a machine or a test. You do not need a stethoscope to see a closed window between two nails. You do not need training to see that the end of a finger has become its thickest part. Nearly every other early warning of a struggling heart is either invisible, buried inside the chest, or requires equipment to detect. This one is printed on the hands, in public, every day, and it only needs a pair of eyes with a memory of what those hands used to look like. Take Doris, that 83-year-old with the sharp eyes for everyone's health but her own. Doris caught her sister's heart trouble across a Thanksgiving table, in time to matter, using nothing but her eyes. If everyone watching this looked, tonight, at 4 hands that were not their own, some number of quiet, months-early warnings would get caught while there is still room to act. That is a power almost no other warning sign gives you. Use it. The one caution is simple. This is a reason to get evaluated, never a reason to diagnose someone or frighten them, so what you say is gentle. Come get your hands looked at with me, not you have heart failure. Let me be very clear about what this video is and is not. Everything I have described is for your understanding, not a diagnosis, and I am not your treating physician. Clubbing and the color changes I described can have several causes, some involving the lungs, some the heart, some the liver or the digestive system, some other systems entirely, and a small number of people are simply born with rounded fingertips that have never meant anything at all, which is why the history of the change matters as much as the shape itself. Only a qualified healthcare professional who can examine you and order the right tests can tell you which one applies to you. If you notice something on your hands tonight, the right next step is not worry, and it is not the internet. It is an appointment. Please talk to your doctor. If you take one thing from the next 20 seconds, take this. The change in your fingertips after 65 is one of the few warnings your body gives you that you can see with your own eyes in your own kitchen tonight. Before the shortness of breath, before the tightening ring, before you cannot finish the lawn. The window test costs you 30 seconds. Ignoring it cost Raymond 3 months. Look at your hands. Look at the hands of the people you love. And if that little diamond of light has closed, do not reach for the cream. Make the call. If this helped you see something you would have walked past, do me one favor. Tap the like button so it reaches one more person over 65 who has been telling themselves it's just age, and subscribe so you don't miss the next one. And if you have a parent, a partner, or a friend whose hands you can see, look at them this week and gently, kindly ask them to look too. I'll see you in the next one.